Hi, I'm Dr. Brian Kaufman, a 15-year CLL survivor, a retired family physician, and the Chief Medical Officer, Executive Vice President of the nonprofit CLL Society. Doreen, can you introduce yourself?
Hi, I'm Doreen Zetterlund. I was diagnosed with SLL in 2015. It progressed to CLL in 2016, and I started a monotherapy treatment with acalabrutinib in 2017. Along the way in Watch and Wait, I discovered the CLL Society and the motto, "Smart patients get smart care," really rings true.
Nathan, you want to introduce yourself, please?
Hello, my name is Nathan. I was diagnosed with CLL about 5 years ago. I've been in a drug trial for about 4.5 years out of Nashville, Tennessee, and I work as a registered nurse.
Doreen, can you tell us a little bit about your professional background and how that played into how you manage your CLL?
Yeah, I was a production manager for film and television. And I segued into being a data project manager for nonprofit organizations. And when I was diagnosed with CLL, I sort of approached it as a project manager, and I'm the lead of that team for my own healthcare. And that's where the self-advocacy comes in. You take the lead, and I interviewed numbers of CLL specialists, well, some not CLL specialists, until I learned the value of being with a CLL specialist. But it just really puts you in the driver's seat of your treatment and your care, and taking the lead and the initiative and that self-advocacy.
And Nathan, I can't imagine that being a nurse must have added significant advantages here. I tell people to leverage all their advantages. How did being a nurse affect your CLL journey?
It definitely helped me as far as, understanding the blood work and that type of information. I did have a little bit of an oncology background, so I did know, some basics about leukemia. I didn't understand the vast differences in the acutes and the chronics and that aspect of it. I, knew reputable websites to get, current information on, and I very quickly got up to speed on CLL, and within about 3 or 4 weeks, I kind of was knowing the route that I was going to take as far as my treatment wise.
I would say that learning curve was a little quicker for you than it would be for some other people. Doreen, you want to talk a little bit about self-advocacy and exactly what that is, what it means to you?
Yeah, Nathan was saying he had a science background. Well, I had an arts and a business background, so there was a steep learning curve. But I took that on with the feeling that if you front load your knowledge, learn what you need to learn, and then if you're one of the fortunate few that has a long watch and wait period or never needs treatment, you don't have to worry about it. You're ready to go because you've got that basic knowledge, because you invested that time up front. So that's the advocacy part, is saying, I may not like all the scientific jargon, but I need to do that for my own care, and that's self-advocating. And then once you start interacting with your specialist and your oncology team, taking the lead in your treatment and asking questions, and you really need to have a good match with your oncology team so that you feel like what's important to you, you're able to do in those meetings, the questions you want to ask, the treatments you prefer. You don't want to just be shut down and told this is what you have to do. You have to advocate for yourself, and that's self-advocacy.
Nathan, you deal with doctors both personally and professionally, but a lot of people are nervous about upsetting their doctor or suggesting something different to their doctor. Do you have any advice and personal experience you could share in that regard?
Each doctor is going to have their own personality, and obviously we have our own personalities. The goal for the patient is to get the best care that they can. Everybody's working together. The doctor's there to provide, the knowledge and the treatment options. And if you're wanting to get the best outcome for you, and if that means getting a second or third opinion, then your doctor should be on board with that. especially when concerned a CLL specialist. Most of them are in larger facilities. They have access to trials that local doctors just aren't going to have access to, and they're there to help you get the best outcome, and they should be pushing you towards that, whether it's with them or if it's, with a different provider. To me, it's a huge red flag if a doctor doesn't encourage you to get the best treatment or the best knowledge.
And should you be worried about upsetting your doctor?
There are, personality types that are gonna, worry about that, but you really shouldn't. They're a doctor. You're paying them to give you the best outcome, and you have to look at it. There's care there, obviously, but it's also, they have their role in your care, and you have yours, and your role is to get the best, outcome for you, whether it's with that doctor or with another one. I left my first doctor about 2 weeks in. She was not a specialist. She treated very few CLL patients, and she was looking more towards a chemotherapy regimen, which I wasn't, and I quickly learned that I needed to see somebody that was more specialized in leukemia.
Doreen, is there anything you want to add to that?
Just to say that taking control of your disease is the most important thing. You educate yourself, you understand your options, and you do your best to work with a team that can give you the treatment you need and the emotional satisfaction of feeling like you're involved in that decision. So that's the most important thing, is that you're comfortable, and that balance between being with a specialist and someone whose personality works well with you.
We have a few minutes left just to sort of give some last reflections. Nathan, I'll go to you first. Any last advice you would want to give to a patient in terms of how they should approach being their own best advocate for their CLL?
Well, obviously you want to look at reputable sites and have a doctor that works for you locally. I 100% agree that you should see a CLL specialist before you put any sort of treatment in you. It's super important that you get your treatments right. With the new drugs coming out and treatments, it's really hard for a local doctor to stay on top of those, and a CLL specialist will be 100% up on all those new options that are coming down the road, and especially starting treatment, because I think it's been shown that non-specialists tend to start treatments earlier than need be with the wrong treatments. So having that CLL specialist in your corner is going to help ensure that you get what works best for you.
Doreen, we'll give you the last say here. And can you kind of give some last advice or tips to someone in the next minute or so?
Yeah, I wholeheartedly agree with what the CLL Society puts forth, is that you really need to have a CLL specialist. And I have never found any CLL specialists that I've consulted with that ever were offended by you getting a second opinion. They all seem to know each other. It's a small CLL specialist community, and they are not offended. It's the non-specialists that seem to be a little bit more forceful, and you should just listen to me. And so that specialist is so important. Like CLL Society says, smart patients get smart care.
Good. I've learned a lot from this, and I really appreciate your input, and I think patients will gain a lot. So Doreen, Nathan, thanks so much for your time, and may your journeys continue to be well and safe in these crazy times. Thanks so much.
Thanks, Ryan. Thank you.